Your liver doesn't usually hurt when it's struggling, but your skin, nails, belly, hands, and even your breath might be giving away its secrets. The body often tells the story first, and today we're exploring the subtle signs of liver disease that you can actually see, as explained by doctors. Let's start with your nails. Your nails grow fast, and they can report internal stress early. First up, are there white bands running across your nails? These are called Muehrcke lines. They don't move as your nail grows, and they tend to fade when you press on them. This is often linked to a low protein balance in the body, which can happen when the liver isn't making enough protein. It's an easily overlooked clue. Next, look at the color. Healthy nails are pink, but extremely pale nails tell a different story. We're talking about a loss of that natural pinkish color, indicating reduced blood flow. If you can still see the white half moon at the base, that's usually normal. But if the entire nail bed is pale, it's worth paying attention to. Like the white bands, this can be tied to problems with protein production. Now for a quick test. Put the nails of your index fingers together, tip to tip. Do you see a little diamond-shaped gap? If not, it could be a sign of nail clubbing, where your nails lose their natural curve. They might flatten or even bulge outwards, making your fingertips look thicker. This happens when the tissue under your nails changes, and it's often seen with chronic internal stress in the body. Following that, let's talk about swollen or rounded fingertips. This is an extension of clubbing. Over time, your fingertips can quietly thicken, causing the nails to angle downward. The soft tissue increases, making your fingers feel bulb-like at the ends. While this can be genetic for some people, it can also be a clue to an underlying issue. Never a diagnosis on its own, but a reason to be curious. Moving from the hands to the abdomen. Not all belly swelling is fat. A key difference is how it feels. A firm, distended belly that feels tight, not soft, is different. This kind of swelling can grow rapidly, even causing discomfort when you breathe. You might notice your clothes suddenly don't fit right around the waist. It's often mistaken for simple weight gain, but the cause is very different. And what if that belly swelling doesn't respond to diet or exercise? If calories were the problem, eating less would work. But when the swelling persists despite your best efforts, feels like constant pressure, and even changes your posture, it signals a potential fluid imbalance in the body, a condition known as ascites, which the liver is responsible for regulating. Another striking sign around the belly is prominent veins around the belly button. When blood flow through the liver is obstructed, your body finds new routes. This can cause a twisting, web-like pattern of veins to become visible under the skin, radiating outward. It's a rare but very clear sign that pressure inside your abdomen has changed significantly. Now, think about how you feel after eating. Do you experience sudden digestive discomfort? Feeling full after only a few bites, pressure under your ribs, or a big drop in energy right after a meal can be early signs. This happens because a struggling liver can affect digestion long before you feel any actual pain in the area. Let's look at your skin. Do you find yourself bruising easily, or getting frequent nosebleeds? Clotting factors are made in the liver. When it's not working well, you might see bruises appear randomly from minor bumps, or notice that they take much longer to fade. People often blame this on age, but it can be a sign that your body's ability to stop bleeding is impaired. We're about halfway through, and this next sign shows up right on your hands. Look at your palms, not the center, but the edges. Do you see redness on the outer edges, near your thumb and pinky, while the center stays pale? This is called palmar erythema. You might even feel a sensation of heat. It's linked to the liver's role in processing hormones, and when seen in non-pregnant adults, it's a classic clue. Back to the skin. Have you noticed any tiny spider-like red marks? These are called spider angiomas. They have a central red dot with thin lines radiating out like a spider's legs. A key feature is that they vanish when you press on them, and then quickly refill when you release the pressure. One or two might be nothing, but having multiple is worth noticing. What about your muscle mass? The body is smart. It will borrow muscle when its fuel processing fails. You might notice your temples looking thinner, your grip feeling weaker, or the padding on your hands reducing. It's a strange phenomenon where fat might stay, but muscle seems to fade away, even if you're eating a normal amount of food. This is often missed in the early stages, and this next sign, people might smell it before they see it. I'm talking about an unusual sweet or musty smell on your breath, known as feta hepaticus. This isn't your typical bad breath from food. It's a distinct sweet, almost earthy smell that persists even after brushing your teeth. It is caused by certain waste products building up in your bloodstream, because the liver is to clearing them out. Since the liver clears toxins, the brain feels it when it can't keep up. This can lead to mental fog or confusion. You might find yourself thinking more slowly, struggling to focus, or experiencing mood swings and forgetfulness. It can get worse as the day goes on. This is a sign of hepatic encephalopathy, where toxins are affecting brain function. Let's connect the dots. The gut and liver are in constant communication. If you're experiencing both constipation and brain fog, pay attention. The constipation can make the brain fog worse over a few days, and you might notice the fog lifts a bit after a bowel movement. The connection between gut health, liver function, and mental clarity is powerful and often underestimated. Here's one sign that people finally notice: yellowing of the skin or eyes. This is jaundice. It starts with a yellow tint in the whites of the eyes and can progress to the skin. It's often accompanied by dark, tea-colored urine and pale stools. This happens when a pigment called bilirubin builds up in the body, because the liver can't process it properly. Speaking of tea-colored urine, this is a sign that demands attention. We're not talking about dark yellow from being dehydrated. This is a consistent dark yellow to brown color, sometimes even foamy, that persists even when you're drinking plenty of fluids. It often comes with fatigue and is always a reason to check in with a doctor. Another incredibly frustrating sign is persistent itching. This isn't an itch from a bug bite or dry skin. It's an itch that comes from inside. There's often no visible rash. It gets worse at night, and it's very hard to relieve. It's linked to an imbalance of bile salts, which deposit in the skin when the liver isn't processing them correctly. Finally, let's talk about the big picture. The liver is incredibly resilient, but you have to reduce its load. This means limiting or avoiding alcohol, supporting your metabolic health by managing blood sugar, and maintaining a steady weight. Addressing viral risks and being consistent with healthy habits is key. Your daily choices make a huge difference. If you noticed more than one of these signs, don't panic, but do take it seriously. Comment "aware" below to let us know this was helpful. And be sure to watch our next video, where we dive into the daily habits that quietly support your liver's recovery. Thanks for watching.